been able to work with the town of Ashland through the shared services group regionally since last December. And I'm really enjoying it so far, and I'm very glad to be here. We've been doing a lot of good work over the last year with our COVID clinics. And I'm at the senior center once a week doing blood pressure screenings and education with medication review and different things like that. I was able to help out with a mental health fair this past spring. And I also help run the child being clinic every Wednesday in collaboration with the school system, which they have all been great in referring students to us. And I think Raj is going to talk a little bit more about that. But yeah, it's been exciting. We've been doing a lot of good work. We're going to be doing flu clinics and more booster clinics coming up, and working on a HPV campaign for trying to target the teens and in the community and the school system, and just a lot of good things. So I'm excited to be here.
Thank you.
Yeah, thank you. All right. Well, we're excited to have and certainly use all the help we can get. That's for sure. So maybe this will be one less thing that Chief Berman has to do. Yeah. He's been carrying a lot of us with his efforts. So I'm sure he already thanks you in advance.
I guess he have put all this together that we are just doing it now, so
yeah,
this was all his game and Diane's game, that, and they put up the childhood vaccine clinic here, and we're just running it now, so but yes, with the childhood vaccine program, I'll update the board in my agenda, but Jessica being single-handedly running the show for right now, so that's great, so
yeah, it's great. Well,
I'm just glad she's on our team now, so
yeah, that's great. Hopefully we maybe get more hours for you in the future, but thank you. All right, anybody, Ed or Jay, any questions or comments? No, everybody's good.
No. Welcome, Jess. I'm sure I'll see you tomorrow, hopefully at the vaccine clinic. Need my flu vaccine.
There you go. All right. Since you've already said a nice hello, Jay, why don't you tell us about if there's any updates with the remote area medical?
Yeah, I mean, there's not a lot of exciting updates. We are beginning to spread awareness. We put together a letter that we might start sending out to folks. I think the biggest thing is that we're starting to reach out to people in Framingham. So key people. Raj has introduced me to the Board of Health, or a person on the Board of Health in Framingham. Chief Roby here in Ashland has connected me with the fire chief in Framingham, and that's I need to speak with them. And Ed Berman here has reached out to the Framingham Police Department, so that let them know that we're going to be doing this clinic and get a little feedback and find out if they have any concerns. Let's see. And we're starting to recruit, slowly, just recruit some folks, mainly the parking lot crew for this event, which is important. But yeah, it's there's not a lot of exciting new developments. But Ed, can you talk a little bit about what your conversation was like with the chief of police in Framingham?
Yeah, so he just said, Ed, we'll figure it out when we get closer. Just you and I will just stay in communication. He's not worried at all. Also, Jay, just so you know, I did reach out to the Metro West Health Foundation, and they put me in touch with an organization. It's called Foundation for Metro West. I spoke with them today, and they are potentially interested in being our fiscal agent as the 501c3. I did invite them to our October 24th meeting. They're going to let me know if they can attend. They're also willing to help us with their outreach. And you can see their website online. They make quite a bit of charitable contributions in Metro West area. They try not to step on the toes of the Metro West Health Foundation since they're doing the health part, but they seemed extremely interested in this and what's going to happen, and want to also help us recruit volunteers.
That's excellent. That's good. And that was called the Foundation for Metro West.
Foundation for Metro West.
Okay, excellent. Thank you very much for doing that.
Yeah. So I sent her all the information today by email after I spoke to her, and she's going to let me know if somebody from their agency can attend our October 24th meeting.
Great. Thanks.
Yeah.
So, okay, excellent. I have nothing else on that, Ron.
Okay.
Thanks, Ed.
Thank you. Yeah, and thanks, Ed, for both of you guys doing this. It's really a huge undertaking, that's for sure. Okay. I guess we can move to the consent agenda, and I guess we can approve both. Everybody was here for the September meeting, September 20th meeting, and the fiscal report 2023. Anybody want to make a motion to approve that?
The whole thing, Ron?
Yeah, because we were all here,
yeah,
right?
Yep.
Yeah.
Well, then I will make the motion to approve the consent agenda.
Second that. Ed, I think you had firsted it before. Ed seconds that. I can hear him even on mute. All in favor? Aye.
Aye.
Okay, great. All right. And Raj, this could be one of the quickest meetings ever.
Thank you.
Yeah.
So as I earlier mentioned, the childhood vaccine program is going great, so it's with some amazing numbers. So far, Jessica have been administered 415 childhood vaccines, and we have 12 kids scheduled tomorrow. So, the numbers are great, I guess at least 200 plus kids, the program have put back in the school, so maybe more, but total number of vaccines is 415 we have done so far, so kudos to Jess, and single-handedly she have done that, so something I'm very proud of, that, it's great, with COVID-19, we've been doing a lot of clinics. There was one last week, and we have put one together for next Tuesday. That's from 12 to 2. Numbers are kind of low right now with COVID, but a lot of people are doing home tests, so we don't know exact numbers. But I usually see 1 or 2 cases every day on an average, so like season week kind of right now. Other than that, the bivalent vaccines are approved for the kids now, Moderna 6+, Pfizer 5+. So, and in the upcoming Tuesday clinic, we have opened it to the kids too. So this clinic on Tuesday is going to be 6+, so anybody who have their last primary series dose 2 months back is eligible. We have a flu clinic tomorrow. We are doing in collaboration with Milford Central Pharmacy. They're gonna be having approximately 100 doses, 3+ for the flu clinic. We're gonna have 2 kind of doses, one for 3 to 65 years old, that's the regular dose, and one we're gonna have a dose for seniors 65+, it's called the high dose, I guess, so we're gonna have that. It's on our website, it's on our social media. I guess we're gonna see some good crowd, and tomorrow we have the childhood vaccine clinic also in the afternoon. Arbovirus update, we have 7 cases in Massachusetts so far. 3 cases are in our Middlesex County. Still the threat is there, even the weather is getting colder. I guess it's not till second frost of the season that all the mosquitoes die and there won't be any more activity. So we still need to be cautious about the West Nile virus. Regarding the hoarding cases, we did had our hoarding task force meeting today. From like 2018, till today, we approximately have 9 to 10 hoarding cases open in Ashland, and we are currently working on it, following up. From the time I'm here, we have picked up like 4 or 5 of them, got some compliance. There is a scholar situation that we pick up near town hall this week, but approximately 9 to 10 cases total in hoarding, that we are dealing with currently. House Street landfill, we have submitted our application for the reduction of the monitoring from monthly to quarterly to the state, and awaiting response from them. I did had a word with Mr. John Mori, who's our contact from DEP for the House Street landfill, and he had verbally approved it, but we're still waiting for the documentation from DEP. And moving forward, we'll be doing monitoring quarterly, hopefully when we are approved. We had a good meeting for the DET. Me and Laura was present. Bernadette was not feeling well that day, so she was not able to attend the meeting. But went well, so a lot of good stuff. I guess DET is doing some good work in the community. And numbers, from, I guess this is my understanding with the data that was presented, with pandemic situation, all the numbers are low, and hopefully they stay low, with almost all of that, what they do, like with marijuana or, alcohol, tobacco, number looks low, And the last thing is about the medical reserve corps, so what they're doing now, because we was in region 4A, and it was a very big reason for the MRC. They're actually dividing it into 3 smaller groups. So what they're doing is earlier, I guess there was like 32 communities in the region, but now they are dividing it into 3 units. And Unit 1 is going to be Central Middlesex, Unit 2 is going to be Metro West, and Unit 3 is going to be Middle Fork, and Ashland is going to be part of Middle Fork. So they're going to be 11 communities. They have asked us, that if we can send a support letter for this restructuring, though irrespective if we send it or not, I mean, we don't have any option. So I'll ask the board, like, if we can send them a support letter just for the restructuring of our 4A region for MRC.
I don't see why not. If that's what they want to do, and it sounds like it would be better being a little bit smaller anyway.
Right, sir. And they're going to have a part-time coordinator for all the 3 units. That's what they're putting in place. Right now, I guess the region is too big, and there is not actually coordination, between all the communities or MRCs. It's a huge group, so I guess it's going to definitely benefit.
Okay.
But we don't have any option otherwise neither, so they're going to go ahead and split.
We're going to try it anyway.
Right.
So
right.
Okay.
And I'm open for any questions for the board now.
Raj, what is the letter of support for?
It's just a format so that we at the health department or the board, right, like wants this to be done, kind of. It's just a simple letter that yes, we'd like to participate in this restructuring.
Okay, got it.
So just saying, hey, this part of Ashland Board of Health, we just like to support this restructuring. That's all.
Mm-hmm. Okay, understood.
It's just they have sent us the format. I guess it'll make their work a little easier if they have it from all the communities.
Right.
But, I guess Tuesday I was on the FEP meeting and they said, they're going to go ahead and do it anyways, unless a community want to stay out of MRC, that would be advisable. They definitely help us, especially in case of the emergency,
Mm-hmm.
So, I guess we should provide one for them, so.
Okay, and they sent a sort of a formatted draft.
Right. So I guess it's there's a gentleman named Matt who's working on this. So I guess they just made a template for all the communities. So they have I think that they're going to send it to the state, that's what they wanted to do.
Oh, I see. Okay.
I'm going to share a presentation with the board. It's going on for like maybe around a year now, that they have looked into, done multiple meetings with the stakeholders, like what can be the benefits or disadvantages of this restructuring. And probably they have to come to it that it's better if they do this way, given the region was so huge, like 32 communities, it'll benefit, just making smaller groups.
Thanks.
Thank you.
So is it still gonna be one regional head, or are there going to be heads of each of these new individual geographical units?
So they're just going to hire part-time coordinators, right? Like, bigger group do have a lot of folks working for them, right? Yeah. But like we had a contact in Framingham, till last year, that was heading that our area functions, right? But now what they're going to do is make smaller coordinators so that I guess it's going to be a little better functioning, or coordination, for taking help from them or, using their services wherever it's needed.
Okay. All right. Good. Any other questions? No? Okay. So as far as, future dates and agenda items, Raj, anything new, at least for me, on the body art?
We're still looking into it, sir. I'm in touch with Salem Health Department. They are trying to put one together too. I know it's taking a little bit of time, and we kind of have one person who want to do it, but maybe by next meeting we'll have something, for the board.
Okay. Yeah. Well, whatever I can do. You said they have a preliminary outline. Is that right?
Right. So they've been working on it, so, and I'm reviewing a couple of them too, so we'll see like whatever suits best to the needs of Ashland, I know we don't have a huge, I guess, presence for body art people here in Ashland.
Yeah. But
I guess maybe by next meeting I'll have a draft for the board,
Okay. And the last item, which we've kind of tabled a little bit, I guess, Raj, you want to explain a little bit about that?
Yes, sir. So what I have found, I know this was brought to our attention that that you will have made some settlement with some of the communities, but doing some research, actually Massachusetts is not part of this settlement. That came to board's attention maybe like 2-3 weeks before. It seems Massachusetts have a separate lawsuit going on against Jewel, for this, We'll be definitely happy to bring all the folks back on the meeting, who have done tremendous amount of work on this, but we're just brainstorming. I don't know if it's just a little too early, given we have a separate lawsuit in the state of Massachusetts, against Jewel, that to do this, but I will leave this to the board, if however they want to handle this, if they want to bring the folks who have done work. I mean, great. This is beyond doubt. People have done amazing work, against vaping and all that in the region. But it's up to you folks, like how you want to handle this,
Yeah. I mean, there's, no harm in waiting, whenever things get a little bit more settled. But, I think the idea was right, whether or not we actually benefited monetarily or not, we still got the point across by, passing, those legislations to, ban flavored vaping products, to kids, to, get it out of stores and into, adult areas. So whether or not we actually got any money or whether or not we really helped the youth, which is really, that's really the more important thing. So, yeah, I mean, we can certainly wait, just be nice at some point, we can, hopefully bring those members on and, at least recognize them. Like you said, there was a lot of work that, Diane did and on Featherston and, some people before them as well.
Well, absolutely, sir.
So-
I mean, that's there, but that was just my thought, thought, like, hey, given the lawsuit is still active, and again, we will be happy to bring everybody on board. It might be a time factor, or if the whole board feels like we should do it now, we will be happy to do it. So it should not be a problem.
Okay. I'm good with waiting. I don't think there's a problem with that. No.
And we'll keep doing more research on whatever we can find around it, and bring it to the board. I did had a conversation with our tobacco coordinator, like, hey, if she find out anything on this, or that how, and whatever comes to our attention or whatever I can find, I'll bring it to the board also, so that we can work on this.
Okay. All right. Right. Anything else? Ed, Jay? Nothing? Everybody's good?
Well, next meeting, Ron, it should be November 1st. Am I correct? First Tuesday?
Yeah, it should be. You're right. Exactly.
Okay. I'm going to be out of town on that day. So
okay.
Hopefully that will be, and I won't be able to connect.
Yep. Not a problem. You're here.
I'll remind Laura. I'll send an email to you.
Okay. We'll remember. Hopefully we'll be able to, have it. So okay. I know I'll be around. So, all right. Well, hopefully you're doing something fun.
Where will I be? I'll be in Florida for a meeting, for a conference.
Yeah. Okay.
Yeah.
All right. Well, try to have a little bit of fun anyway. So,
yeah.
All right.
I will.
At least as of now, we'll plan on having that meeting on November 1st. Jessica, thanks for staying on. You certainly don't have to. This was relatively quick, which is good. Everybody, anybody want to make the motion, the most important motion of the evening, even though this wasn't a long one?
I'll make a motion that we adjourn.
Okay. Second?
I'll second.
Okay. There you go. All in favor?
Aye.
Hi.
All right. Thanks, everybody.
Thanks.
Everybody have a good
All
night.
right. Thank you.
Thank
Right.
you.
Have a good night.
Yeah. Thank you. All right. Bye.